The American Medical Association, or AMA, reported that out of 1,000 providers, 940 saw delays in care due to prior authorization, or PA. Even worse, 8 in 10 said their patient abandoned treatment while waiting. It doesn't matter if you manage a large-scale healthcare facility or a neighborhood practice, statistics like this don't bode well for your bottom line. The truth is that denials make it hard for your organization to operate because they have direct impact on the revenue that helps keep your lights on. Yes, in a perfect world, healthcare organizations see patients and administer treatment. Yet the reality is much different. Managing and submitting claims is an unavoidable aspect of the healthcare space, which inherently also means the same is true for the reception of denials and payers. It doesn't have to be this way. And prior authorization denials don't have to be such a common occurrence either. But in order to stop prior authorization denials from happening, we have to know why they happen. Hi everyone, I'm Kaylee from eTactics, and today I'm going to explain how prior authorization denials happen. Before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. Also, hit that alert bell icon so that when we post new, helpful content, you get notified. The truth is, insurance companies are out to get you. They don't care one way or another, they deny your claims on a whim because they feel like it. I'm kidding, mostly. In a perfect world, practices care for patients. Patients have health insurance, and health insurances pay practices for the service they rendered. If you've worked in healthcare for a while now, you know that that's not the case. You see, prior authorization is one of the first steps that should occur before a medical professional provides or performs a service on a patient. To be more specific, before any servicing happens, a doctor needs to ensure that a patient's insurance provider will pay for it. Prior authorization also applies to prescriptions in most cases. Anyway, prior authorization happens by either calling an insurance payer or contacting it electronically. Let's look at an example. This screenshot comes from Healthcare Partners. It has an entire section of its website devoted to explaining its prior authorization process. It confirms the point from earlier. In most cases, PA happens by speaking with a representative of a provider or electronically. Prior authorization is a step that happens ideally before a patient receives any form of treatment. That way there wouldn't be any denials. However, the reality is much different. If you scroll down from the page that the previous screenshot was on, you should stumble upon the section of Healthcare Partners' webpage. You see, payers place time requirements on prior authorization. In this case, for routine procedures, Healthcare Partners requires authorization for services within 14 days of services rendered. That deadline isn't unique to Healthcare Partners. Many other healthcare insurances also use 14 days. Sometimes insurance payers provide their exhaustive list of PA services, prescriptions, etc. online, like the example screenshot above from Paramount Healthcare. Paramount Healthcare's PA document is a 14-page long table with what seems like thousands of rows. After all of this, the question still remains, how do prior authorization denials happen? Well, prior authorization denials happen when the provider doesn't have PA from the patient's insurance organization. Maybe the payer rules change unexpectedly. Maybe the payer is new to the practice, so the payer's PA requirements aren't familiar. Maybe your staff of billers and claim managers can't keep up with the changes and additions to so many payer plan pre-certification rules. Maybe your practice does not have the capacity to handle prior authorizations and can't find a reliable vendor to outsource to. Yes, the prior review process is frustrating, not to mention the fact that the expense of denied claims results in receivable bottlenecks and write-offs. But that doesn't mean that you should give up hope. There are ways to avoid this type of denial, and even if you still receive them after putting in place several safeguards, this type of denial can be overturned. Now that we have some common ground as to how prior authorization denials happen, we're at a good starting point on how to fix them. If you'd like to learn more about handling prior authorization denials, reach out to eTactics. And you already made it this far into this video, so you might as well like it, share it, and comment below.